Wife, Marte Parr, joining us in the KUAM News Zoom room. Good morning.
Morning.
Unmute.
There you go.
Hey, Benny.
Morning.
Good morning, Benny. Just so you guys know, Benny right now has been diagnosed as a COVID-19 positive patient, and we were keeping an eye on you in the KUAM News Zoom room, Benny, and you know, not looking too good this morning. Can you describe for us maybe what day you are on with the virus and some of the symptoms that you've been experiencing since the onset?
Okay. My first symptoms was I didn't have no smell, and when I first got positive was only 3 days. I had chills and headache. So my boss said for me to get tested, and I got positive. I was feeling good when I went to go get it, but as soon as they said I was positive, that's when I felt sick again. So I got it twice. It's not that easy.
What are you feeling right now, Benny?
Right now, I'm getting better. Thank you, Lord, my family, that for their prayers. My deceased family, I met them in my dreams. So they told me to wake up on Friday. The second time around, I couldn't get up. I couldn't lift my arm, nothing. I didn't want to wake up because my head was pounding so hard. But my deceased family that I met in my dreams told me to fight it. So that's what I did. The second time around, it was worse, but I fought it.
Let's bring on the wife, Marty. Brian, we had talked about this. We actually asked Lillian about this yesterday. Marty, can you walk us back? So you guys are saying, and this is something that you had told me the doctors were interested in at the hospital, that Benny has been hit with COVID twice. Can you take us back to his first bout with the virus and then walk us to where we're at now?
Okay. Yeah, I've been the documenter. So basically, he's working on a construction site, and we first heard of the first positive on that case August 27th. Our company immediately pulled all the crew off and isolated just to be safe. Everyone in that first round got tested by September 1st. Everyone was negative, including myself because of close contact with Benny, of course. And then the second time, when Benny did go back to work, they reported back to the job site after 2 weeks. He reported on September 10th, 11th, and the 14th. And then the 14th was pouring hard rain, so of course they got soaking wet. And he came home, and he immediately took off his clothes, took a shower, and went to bed right away. And so in usual cases before COVID, he would just take like a little Theraflu, go to sleep, and he'd be fine the next morning. In this case, on September 15th and 16th, he woke up with headache, chills, not so much a fever, a little bit, but not much. And then it was just more that he just had that headache, so he was taking Tylenol. But he did say he couldn't smell. And so that was a little concern. Then we found out a coworker tested positive on the 15th. Therefore, he went to FHP to test on the 16th. And we got the result the 17th, and that he was positive. We also found out 2 other coworkers were positive. And then on the 18th, I found out I was positive as close contact with Benny. And so there was a total of 5 of us within the company that were positive. and we did all our self-isolation. But Benny, in the first round, he basically only had 2 days of flu symptoms and 5 days of no smell. And the second week, he was out there in the yard working on the honey-do list, and he was fine. But when he went back to work on the job site October 8th and 9th, then the 9th he already started complaining of a headache. The next day, on Saturday, he was having a little fever, some chills, but by Sunday he was in high fever up to 102.3. He was shivering. I could hear him down the hall. He kept hallucinating about some of our deceased relatives. And when I woke up, I was talking to public health agents, and they thought, it can't be COVID because we've never heard of a case that COVID has been so close. And I said, but he's got all the symptoms. He's showing all the symptoms. And of course, the testing facilities are closed on Sunday, so we had to wait till Monday. So we already had a plan Monday morning to go to the testing site when it opened. And when we woke up, he was really bad. He hardly could get up. His fever was high again. And then this time, his whole right arm, his whole right side, he couldn't move. So I immediately panicked. I'm thinking stroke. I'm like, can you walk, or do I need to call an ambulance? And that day, which is the 12th, Monday, it was one of the scariest things, because when they were wheeling him away, just so you guys know, when you go to GMH, there's a stage 1 with security where they ask you, pre-screen you. They radio you whether you're going to continue to stage 2. I drive up to stage 2. I can't get out of the car. They come to the car. They got him in a wheelchair, pulled him into that carport area where the ambulance usually goes. They swabbed him there, took some vitals, and then wheeled him away. And that was when I broke down. I didn't know if I'd ever see him again. I didn't know if he was having a stroke. He kept complaining his head was pounding so hard. It felt like it was going to explode. He wished he had a knife to relieve the pressure. He was talking a little crazy. And that's why with some of the hallucinations, he was really scaring me when he started bringing up our deceased family,
right.
Because one of them did die of a stroke and an aneurysm. And so it really scared me at that point whether I would see him again. And fortunately, they took a bunch of tests. My sister is in the medical field in Oklahoma, and I reached out to her. She kind of walked me through what his symptoms are. She was actually worried he had meningitis, if not a stroke. So she told me that they're probably going to do a CT scan, a spinal tap, and blood work, of course. When I got his results, she confirmed that everything was negative, like they said. But at that point, I was really a mess. I just drove down to EPAL Beach, and the cops there, I told them, I'm just here to just sit in the shade, and I just want to be near the hospital. And, the doctors are calling me on my phone with questions because Benny can't answer them. And, it was just, I just needed that time to just kind of sit quiet. I was under a shaded tree near GBB. And, it was just a time of reflection and just crying and praying and waiting, because of course my sister told me the test would take a long time.
Right.
Fortunately, the CT scans showed no tumor, no aneurysm. The spinal tap was clear, no meningitis. So they eliminated the brain, they eliminated the spinal, but now we had to worry if there was an infection in the lungs. So we were waiting on some cultures to come back, but they stabilized him. They released him, and he tested negative on that Monday. And mind you, he also tested on October 2nd negative when we were done with our 14-day quarantine from having the first positive COVID. On the 14th, I had to take him back again. His fever was back. When they checked him at the emergency, he was 102.8 fever. And his blood pressure was okay then, but it was more the fever, and he was still having that pounding headache back. And when they tested him on Wednesday, the 14th, he came back positive. And so they decided to admit him. which I wasn't concerned then because I knew they're probably doing it out of precaution.
Right.
Because he had been in ER Monday and, ended up back in ER 2 days later. So
Right.
I told him, honey, they're probably going to keep you, but just keep your cell phone. I made sure he had a cell phone to communicate, because I know they're short staffed and,
Right.
we got to do our part.
Marty, I gotta break in. Marty, I'm just gonna break
Okay.
in here real quick. To our viewers on KUAM TV, you're not gonna want to miss the rest of this interview. And thank you so much for joining us on the link this morning. You can jump over to our KUAM News Facebook live feed where we'll get right back into it with Marty and Benny and share this very compelling story with the audience here. So jump over to the radio again. We're KUAM FM 93.9 in Agotnia. It's the link. This is The Breeze. To our viewers on KUAM TV, my name is Chris.
I'm Sabrina.
Thank you so much, and we'll see you over here. Hasta adios. Marty, so husband was admitted, tested positive for COVID. You gave him a cell phone. You watched him walk through that hall. What was going through your mind that moment?
I was scared. I didn't know if he'd come back. I've never seen him this week. He worked over 20 years at the port. I mean, he worked 12-hour shifts. He was always strong, always stayed busy. Those that know him, he's always working, and to see him, day after day, just where he couldn't even get up out of bed. But I finally got him to have a nurse call me to give me at least an update once a day and let me know what was going on. And I mean, they tested him, from what I understand, they tested him 4 times, and all 4 times he was positive. So it wasn't a false positive. And, he got sick each time he went to the job site. And I did everything I could to just go straight to work, go home. He was always the one who went to the gas station shopping because I have bronchial issues and we were afraid I'd catch it. And sure enough, I caught it and I was already coughing. And, we both cried when we found out I was positive because we really didn't know what was going to happen there. But for him to catch it a second time, it was just, and it hit him so much harder. When they say the second wave will hit you, it does. I mean, it just, in a day or two, he could not get out of bed. The pounding headache was just all over his head, all through his neck. And, of course, he wanted me to massage him. And I'm like, honey, I can't be close contact with you. And, it's just me and him. And, I'm trying to do the best I can. Every time he needed something, I just remember close contact is 10 minutes or more within 6 feet. So I made sure I was like only 1 minute or 2 minutes at the most, to tend to him. It was just really nerve-wracking. It's been an emotional roller coaster. But the biggest part was on the 19th, after 5 days of hospitalization, and I got a call from Take Care saying that since he tested positive, there's an exclusion in our benefits. And it says, to the extent that a natural disaster, war, riot, civil insurrection, epidemic, or any other emergency or similar event not within our control results in our facilities, personnel, or financial resources being unavailable to provide or arrange for provisions of a basic or supplemental health service or supplies in accordance with this plan. Therefore, we got a letter from them saying that no benefit will be paid in connection with epidemic-related treatment as specified under general exclusions, page 22. And we have 180 days to appeal it. Of course, I was just outraged when I heard this. I couldn't believe it. I'd been talking to the doctors and, Benny being an unusual case, they wanted to draw more blood for the research as to how he was able to survive it not once, but twice. He was fighting it. The doctor said he was the only one on the floor that could get up out of his bed to walk to the toilet. He had 5 different roommates during that time, and each one of them was in a worse condition, and they kept wheeling them up to other floor where I guess is oxygen. But, through the whole thing, I never expected Take Care to come back and tell us, we're not going to take care of you. It was like an oxymoron. We never got that clarification during open enrollment. I looked in our plan. I immediately told my Uncle Eloy what had happened because, of course, we take care of them. Benny's always over at their house doing their landscaping and whatever house repairs they need because they're both in their 80s. And Uncle Eloy immediately called his GovGuam retirement trying to find an answer with his Aetna. And I fortunately looked on the internet and found that in their COVID paragraph, they said that the only thing they don't cover is COVID tests that are not necessary. So to return to work or just because you want to find out, they're not going to cover that, which is standard with basically our insurance as well. But the thing that got me was Aetna in their paragraph says that they're waiving the member sharing costs during COVID for their treatment. And here we are being left with right now what is estimated over $16,000 that Take Care is not going to cover. And I thought back to the media headlines when GMH was not accepting Take Care, and then just recently in September they started bringing them back, and then now you have this again. I mean, the frontliners in GMH saved Benny. They really did their part to give him different antibiotics, and he wasn't reacting, so they tried something different. Finally, they found a combination that was working for him, because for 3 days he was still having fever come back, and we couldn't understand why. And it's just, I feel for the GMH because I am a GMH Volunteer Association member, and you have the frontliners risking their lives, and then they're gonna get screwed over on payment. I mean, I just feel that the public needs to know that you need to check your insurance policy. You need to check the exclusions to make sure you're covered, because anything after positive, they're not covering. That's what I was told, and that's on my plan. I'm on a platinum premier plan through the Guam Contractors Association, and my exclusions right there in page 22 that they're trying to say that they're not going to cover it due to epidemic.
Right, Marty. So I mean, enough, right? Benny, the COVID of his conditions, it doesn't look good. But dealing with all that and then having to deal with this headache and now you're facing thousands of dollars.
Anxiety and the stress.
How are you managed?
We just pray. I've got my GMH Volunteer Association prayer warriors that we're always just praying for everybody. We're praying for a cure. We're praying for a solution. It's really hard because Benny, of course, is out of work. The Department of Labor Employee Rights flyer with the Family First Act, Benny already got paid 2 weeks of leave. So there's nothing that really says you get 2 weeks of leave per occurrence. So he's already exhausted his paid leave. So he's no income right now. We both got our stimulus checks not until mid-August, to give you an idea. Benny filed for PUA. We have a Discover Guam tour business that's been closed down since March. And so we filed for PUA for him from March until he started with the construction company. And it's hard. It honestly is hard because we're trying to figure out what's going to happen. I've had a car breakdown. I've had to empty the septic tank. I've had all kinds of different expenses going on during our positive isolation. It's like one thing after another, and we just keep praying. And our family's been a big support. Our family's been dropping off food or whatever we need. They leave it in our truck outside, and then they honk, go away, and then we go pick it up. Public health has been very good about calling us every day about our condition. I didn't even know they had a service where you could order online with cost less, and social workers will bring it to you. But Benny and I are not that type to take advantage of the system. We told them straight out that save that for somebody who really needs it. Our family's there for us, and we're just getting by with what we can, and I'm grateful for all the prayers. I'm grateful that he's home. We told the doctor, I'm sorry, I know you want more blood, but he needs to get released now because they're not going to pay for it. The doctor said he even called and he couldn't believe it. But they transported Benny from the hospital to the house, and I'm taking care of him, and he's under 7 different prescriptions, which kind of took its toll yesterday. He really felt it. But it's day by day, we lift it up to the Lord.
I'm just pretty stunned right now. I don't know if you covered this with Bree, Marty, but the doctors and with Benny testing positive twice, what were some of the things they were saying? Because we haven't really seen until recently in national and international media reports cases of COVID-19 reinfection.
Well, when it was a chance of him being positive, I started jumping on the internet, and yeah, you're right. There was only like a 1 or 2 case. I know I read about somebody in Las Vegas, but and his case was the same thing. The second wave hits you harder. I went on the CDC website, and of course it says that we can hold our symptoms up to 3 months. And, so I'm still taking caution because of my bronchial issues. And so I'm basically thinking that for 3 months, I'm high susceptibility to catch anything. So, we're kind of like trying to create that bubble. But for Benny, it's just what would have been him just getting soaked in the rain and just taking Theraflu, sleeping it off, and 24 hours later, he's fine. This one just really knocked him, off his noggin. So I've never seen him like this. It's the weakest I've ever seen him. One of our aunts saw him from a distance sitting in a chair leaning over. He looked like he had a stroke, and it just hit her emotionally because she was the one with our uncle who passed away. It's scary. Our family from Washington, Las Vegas, California, they were all, checking in. I was everybody. When it first happened, I thought he had a stroke. I really thought he was having a stroke. And then my sister scared me even more when she said meningitis. I actually had to look it up on the internet to really understand with brain damage and disability. I didn't know what to think. And the thing is that now that he's caught it twice, people said, oh, you can't. And he did. And his body obviously still has something in him. It makes you wonder that, when he goes back to work, what happens? Will he catch it again? You have to worry about those kind of things.
Right.
Because no one really knows. This is a new virus for so many.
Yeah. Benny, if you could, can you give a message out to the audience? Catching COVID once and walking away from it. Now you got it a second time. What do you want to say to the people listening out there? Unmute, Benny.
Can you repeat that one more time?
What's your message to the audience out there, Benny, about the virus and being safe?
About the virus? The second time around, I didn't want to get up, but my deceased family that all passed away, that I was close to, told me to wake up and fight it. So that's what I did. I woke up, I was telling my wife about my family, my deceased family, that I was hurting so bad that I didn't want to come back. But thank you, Lord. Thank you to my family for their prayers. And I was just I had to listen to my grandma because my family needed me the most. So I had no choice to get up and fight it. Sure enough, I asked my wife to take me into the hospital. I couldn't walk. It was just crazy where my head wanted to explode because my Phil that passed away asked me to massage him. He always liked to ask me to massage him. So I did. I was happy to see my family, my diseased family. But Grandma said, leave BJ alone. I said, okay. So all of them in my dreams were getting close to me and said, BJ, wake up and fight it. So that's what I did. I told my wife, take me to the hospital. My head was pounding because my Bill had that. He exploded with his head. When he had a stroke, he couldn't lift his arm, so he asked me to massage his arm. And when I woke up, I couldn't lift my arms. I couldn't lift my body. My head was just crazy. So my wife had to help me, pull me off the bed to get me to the hospital. And thank you everyone
We're praying.
for your prayers. I'm just happy. I'm glad to be home with my family, my wife. The doctor asked me if I could stay at the hospital to get some more of my blood. The doctor said I was the only one in the hospital out of all floors that made it out of the bed, walked to the bathroom, shower, everything. I didn't have no headaches. Everything was just gone. I was happy. I was ready to come home to my wife, but he wouldn't let me go. So I said, okay. So I just kept staying at the hospital. They gave me 5 different roommates. All 5 of them had to go to different floors to get oxygen. I asked the doctor, why not me? He said, I'm doing good in that room. I'm doing good. So I just said, okay, I have to bear it. I got no choice. But what's so funny was when I was in the hospital, I had hiccups. I had hiccups from day and night, non-stop hiccups. Every time I'm gonna get well, my hiccups will pop up. I was just happy that it's gone now because I'm exercising, I'm working out in the yard. But the most importantly is I slacked off on the second positive, thinking that I'm not gonna get it again. But sure enough, I did. So I want everybody to know, just because they said, oh, you're not gonna get it again. Yes, you will. everybody
or you can.
has to be cautious and use their mask regardless of what. I have a coworker that's tested positive, but no symptoms at all. Young and healthy. So I just kept going. Thank you, Lord. Thank you, everyone, for listening to this. Be very careful, everyone, while you're out there. This COVID, it's crazy. So, when the doctor called, take care, they told him that I'm not covered because I'm tested positive. So the doctor called me back because I have no choice to let you go home because it's messed up about me not being covered. That's why I was happy to come home. Even though if the doctor asked me to stay back for another day, get some of my blood, but I got no choice to let me come home, and I was happy.
Martha, I have to ask this,
Yes.
Because this is just a unique situation, even the doctors have said this to you. Have you maybe reached out to any of our elected leaders to see if they could help you, the governor, or the legislature?
I did email my documents to someone on the governor's staff, and they are looking into it. I did have a couple senators through my WhatsApp that I also said, this is something that I wanted them to be aware, because I know that there's the choice bill coming up for open enrollment season. And then, there's been assistance for bereavement of dead patients, but what about the living? And, it's like, I already called GMH. They said our estimated bill is over $16,000. There was a transport from GMH to the house that we don't know those costs yet. But right now it's over $16,000. His first ER visit was almost $5,000, but he tested negative. So I'm going to assume that, but with him being positive, it's over $16,000. And I mean, we don't have that. And I mean, when I first read, the exclusion, and this is why I want, like the AG's consumer protection opinion, I want revenue taxes, insurance regulation, errors and omissions to take a look. Because when I read this clause, to me it said, events that are not within their control results in facilities, personnel, or financial resources being unavailable. But they're available. The clinics are open. They have limited hours. They are open by appointment only. So this is not unavailable. So when I read this, I take it that this doesn't apply. But then again, I'm not an attorney. So I'm looking for some legal opinion on this. I have 180 days to appeal it. Why 180 days? I mean, that's just 6 months that you're prolonging your bill to pay off, GMH and the frontliners. And, I just don't understand that part. I know that back in March of 2020 was when GMH, put out the headline that they're not accepting Take Care anymore. And then September, they started accepting them. And I can see why. I can understand it now, why GMH has issues with Take Care. Because here I am, and with a Platinum Premier plan, and if you have Platinum, be aware, page 22. But it's just sad. I mean, I've also reached out to the Guam Contractors Board. I sent an email for them to be aware of it. So when they consider companies for open enrollment, that they are aware of these things, so that they know which of their members could get potentially screwed over technically. It's sad. When the girl on the phone, one of the GMH volunteers was reaching out to me, and I mean, she's trying to wish me well. And so she told me, take care. And I said, I don't want to hear that word. And then she goes, okay, stay well. And we started just joking. It was just kind of, in light of everything. But I just felt it was more of a hypocrisy, that the name says take care, but you're not taking care of us. And so our duty as Chamorros is we need to educate the public. You guys need to check your insurance company, check the policies, check, the exclusions. I mean, I went online and I started going through all the different websites, and, I saw just general exclusions on Select Care. I didn't see anything on Stay Well. I went on Aetna. I mean, I was trying to do my due diligence. Mm-hmm. And I mean, again, I'm not the insurance guru, but it just seems that this one plan that I just happened to be on is not covered. And it's sad. It's sad. I mean, we reached out to our mayor, Jim Bloss, because we live in Barricada, and she couldn't believe it. Everybody that I seem to talk to, they are just speechless by it. And, this might not just be Guam. It might not be OOG. So that's why on Facebook, I told people in California, our families in Las Vegas, California, Washington, you guys need to really spread the word, because I don't know if there's other insurance companies out there trying to get out of paying bills with an exclusion.
Well, we appreciate you, sharing your story, Benny and Martha. And Martha, I guess we'll leave it with you, just your final words and your message to people out there listening and watching.
Well, first off, all glory to God. I mean, there is power in prayer. And I thank all my GMH Volunteer Association prayer warriors, my prayer warriors out in California as well. And all the family that, chipped in to help us. But, just know, even if you're a spouse, you do need to wear your mask at home. The first time I didn't necessarily wear it at home, inside. But, after the first battle, I started doing where I cook, and then we don't even eat at the dining table together. He'll eat and I'll eat separately. He has his own bathroom outside. We talked about when he goes back to the construction site that he really needs to decontaminate. I mean, they're not wearing full PPEs. So as like a hospital, they have their, construction vests, their hard hats, their safety shoes, everything. And I told him I want all that construction stuff to stay out of the house, because I tried to do everything to keep myself shielded, and it still came inside our house. And the only way could have been through some contamination from maybe his clothes, his shoes, something. Right. We're vigilant about having a spray bottle of alcohol every handle we touch. We spray the microwave, we spray the refrigerator handles, everything. Yeah. We're more vigilant about it the second time around. And, maybe that's why I didn't catch it the second time.
Martha, was this project construction? Was this on the base?
Yes, it's a naval-based project, and we know that the NAVFAC follows the CDC guidelines, and they've put new safety measures in place. Every time somebody sprays, every time somebody is positive, they spray down the site. There is a 14-day quarantine for the company that does have the positive. There's a point of contact with each general contractor and subcontractor that they do report in, any COVID. And, it's one thing I can tell everybody is take notes, take a journal, write down what your symptoms are every day, write down where you go, because when you do end up with that positive and they try to do the contact tracing, there's a lot that you can't remember at that time. And so if you're keeping a journal now, then when it comes time for contact tracing, it'll be easier for public health or your boss or whoever to do that contact tracing.
Thank you so much, Marty. Benny, thank you. We'll let you rest now, Chalu, but thank you for your message out to the people.
Take care, Guam.
Thank you, Marty. Benny, Estelle, guys, get some virtual corned beef fried rice on your way out, okay?
That's his favorite. You got it.
There you go. Take two. Take two. Benny, está okay? God bless you. We'll pray for you. Marty,
Uh-huh.
Marty, if you get a
They're praying
GoFundMe,
for you.
if you get a GoFundMe going or anything, make sure you send me the link and we'll put it out for everybody. Okay?
Okay.
Yeah.
Will do.
Just in case. Okay, that's that, guys. Make sure you get that corned beef fried
Okay.
rice.
Take care. Be safe.
God bless
We
you.
love you.
Love you too. 8:35. We'll take a really quick break and we're coming back with Admiral